Hello friends, welcome to Conceptual ENT classes. My name is Dr. Sarvjit Singh. I have done my MBBS from UCMS, University College of Medical Sciences and associated GTB Hospital, Delhi. And I have done my MS ENT and thereafter my senior residency from Vardhaman Mahavir Medical College, VMMC and Safdarjung Hospital, Delhi. I am a faculty for ENT and also known as Otorhinolaryngology. I have been teaching for last 13 years ENT to various students who have appeared for the FMG exam, the NEET PG exam, which was even earlier known as All India exam, the AIMS exam, the JIPMER exam, etc. Now, during this teaching, I have understood one simple basic fact that unless you build the concepts for any subject, you are likely to forget that subject. The concepts will help you retain that subject for a much longer time. And with this changing scenario, with now all these clinical questions coming into your exam, it is very important for you to build the concepts around the subject. If you don't have concepts, if you just mug up the facts, you will not be able to solve the recent clinical questions which are being asked in the exams. Okay, so I've always called my classes as conceptual ENT classes because I believe to build these concepts, to make your understanding of the topic clear, and it also helps you retain that topic. Right, so let's start with the classes and we'll talk more about it later on in between the classes. All right, so the first topic that we will start is the ear topic. Right, so ear, the E is the first part of ENT or auto is ear. Now let's start with the basics of the ear, the fundamentals of the ear. Now in the fundamentals of the ear, we have two topics to discuss, the osteology and the embryology. This forms the foundation for understanding of the ear. Unfortunately, this topic is not given in any undergraduate book as such. So therefore, this topic is more important because it's not given anywhere. However, a lot of MCQs are asked from this fundamental topic of the ear. Okay, so MCQ wise, it is a very, very important topic. For concept building also, it is again a very important topic. Let's first start with the osteology. Now, when I say osteology, I basically mean the temporal bone. We know that temporal bone forms part of the skull. And how many bones are there? There are two bones. It's a paired bone, one on each side. Now, this temporal bone, one on each side of the skull, this is said to be the most complex bone in the body. You see, normally the bones, they are formed by 1, 2, 3 ossification centers. This bone is so complex that it takes 20 ossification centers to form this bone. Okay, so this is the most complex bone in the body formed by 20 ossification centers. Right, let's discuss what are the parts of the temporal bone. So temporal bone has 4 parts. Number 1, we have the squamous part. Number 2, we have the petromastoid part. This petromastoid part, after birth, can be differentiated into 2 further parts, that is the petrous part and the mastoid part. So after birth, it differentiates into petrous and mastoid part. Right? Then we have the tympanic part and finally we have the styloid process. So these are the 4 parts of temporal bone. Right? Let's look at this photograph. This is the photograph of temporal bone. You can see the lateral view of temporal bone. Now let's identify the parts in this bone. We can see over here the number 1 squamous part. So you can see this big thin plate of bone that's known as the squamous part of the temporal bone. It covers the temporal lobe of brain. Right? So this part covers the temporal lobe of brain. What can you see in this part? You can see a plate of bone. This is the thinnest part of the temporal bone. Okay, you can see a process coming out that's known as zygomatic process. The zygomatic process anteriorly combines with the zygomatic bone, right? So that's the zygomatic process coming from the squamous part of temporal bone, right? This zygomatic process also forms a fossa over here for the temporomandibular joint, right? So there's a temporomandibular joint between temporal bone and mandible. So that is between the zygomatic process of the temporal bone that forms this fossa for attachment of the mandible, condyle of the mandible, right? Now what else can we see? We can see the EAC. That's the external auditory canal, also known as EAM, external acoustic meatus. Okay, so it is also known as external acoustic meatus. So you can call it as EAC, external auditory canal, or EAM means the same thing, right? Now behind the EAC, we have the petromastoid part. So remember, the second part was petromastoid part, and this is divided into petrous part and mastoid part. What we are able to see in this view is only the mastoid part. Why? Because the petrous part is on the medial side and therefore you cannot see it. It is on the other side. Right now we have the lateral view with us. Okay, so we are able to see only the mastoid part right now that lies behind the EAC. So let's talk about this mastoid part of temporal bone. Now, what is this mastoid part? This part starts developing 6 months after birth. Okay, that means at the time of birth it is not present, right? This mastoid part is not present at the time of birth. At the time of birth, we have a single part known as petromastoid part. We don't have a separate mastoid process. Okay, it starts developing 6 months after birth. Now, why it starts developing 6 months after birth? Okay, that's a question. You see, on this mastoid, we have attachment of muscle. Which muscle? We have the attachment of sternocleidomastoid muscle on the lateral aspect, and we have attachment of posterior belly of digastric on the medial aspect, right? So there are two muscles attached to it. We have the sternocleidomastoid on the lateral aspect, and we have the posterior belly of digastric on the medial aspect. Okay, so lateral aspect sternocleidomastoid, medial aspect posterior belly of digastric. Now by 3 months, the child starts neck holding. By 6 months, the child starts sitting. Due to these actions, during sitting, the child is holding the neck, and the sternocleidomastoid starts pulling the mastoid process. So this pull of the mastoid process, okay, by the sternocleidomastoid muscle leads to the growth of this process. So this process starts developing 6 months after birth, and that is mainly because of the pull of the sternocleidomastoid muscle. Okay. Now, the mastoid tip, you see, this tip appears by 2 years of age. So the tip will appear by 2 years, and this mastoid will keep on growing. It reaches adult size by 18 to 19 years of age. Then it will reach adult size, right? Okay. Now, this mastoid, what is there inside the mastoid? It is a cancellous bone. It consists of lot of air cells. Okay, so there are a lot of bony air cells in the mastoid. It is a cancellous bone, and remember that the largest air cell of mastoid is known as mastoid antrum. Antrum is the largest air cell of mastoid. Now there's a question that you have to remember. The most important question among all of this is that this mastoid antrum is adult size at birth. Okay, very important question. This is adult size at birth. Now let's go back a little bit and let's revise what we have just told you, that mastoid is not present at birth. Okay, remember I told you mastoid process starts developing 6 months after birth. So at birth we don't have a mastoid process. We have a single unit known as petromastoid unit. Now in this petromastoid, this mastoid component is represented by mastoid antrum. Okay, so we at the time of birth we don't have a process, we only have the mastoid antrum and there are some small cells around it, and this antrum however is adult size at birth. So at birth no mastoid process, but antrum is there and antrum is adult size at birth. Okay, very important question, right? Okay, so we come back to the temporal bone. We have seen the mastoid part of the petromastoid process. Let us look at the petrous part. To look at this petrous part, we have to rotate the temporal bone. So as you see over here, I have rotated the temporal bone. Now we can see the medial part or the petrous part of the temporal bone. Okay, now remember, petrous part of temporal bone, this is the most complex part of temporal bone. Remember, temporal bone is the most complex bone. Now, petrous part is the most complex part of this temporal bone. Right? Now, what do you see in this petrous part? In this petrous part, you can see over here that there is an opening. This is the opening for IAC. IAC means internal auditory canal. Okay? You can also call it as internal acoustic meatus. IAM. Okay, so IAC or IAM, internal acoustic meatus or internal auditory canal. Now that is the opening in the petrous part of temporal bone. That's the canal. Now where does the canal open? It opens, you can see over here, it opens in the posterior wall of petrous part of temporal bone. So remember, it is in the posterior wall of petrous part of temporal bone. Right? Okay, now what passes through the IAC? What are the contents of the internal auditory canal? The contents are, number one, we have the vestibulocochlear nerve, that is your 8th cranial nerve. Right? So that goes through the IAC, it will later on divide into the cochlear nerve, okay, and the vestibular nerve. The vestibular nerve further divides into the superior vestibular nerve and the inferior vestibular nerve inside the IAC. Right? Then we have the facial nerve, the 7th cranial nerve. Right? Okay, we have the labyrinthine artery, that's a branch of anterior-inferior cerebellar artery, AICA. Right? So we have this labyrinthine artery and also supplies the facial nerve. Right? Next we have the vestibular ganglion. Remember, the vestibular nerve first goes into the vestibular ganglion, which is in the IAC, and thereafter it divides into two branches, superior vestibular nerve and inferior vestibular nerve. Right? Okay, then we have the nerve of Risberg. Okay, it is also known as nervus intermedius. We will be studying about this nerve later on. So nervus intermedius, it will go and join the facial nerve, the 7th cranial nerve, in the IAC. Right? So we have the nerve of Risberg in the internal auditory canal. Right? So these are the contents of the IAC or IAM. Right? Let's come back to the petrous part of temporal bone. So now, to understand this petrous part of temporal bone in detail, let us study the embryology of the inner ear. Okay, why? What is there inside the petrous part? This petrous part of the temporal bone, it contains the inner ear. Okay, so it has the inner ear. So to understand the bone, let us do the embryology of the inner ear. All right, so let's come to the inner ear formation. Now, we are looking at a growing embryo in the rhombencephalon stage. So this is the rhombencephalon stage of the embryo. You can see the cranial neuropore, you can see the caudal neuropore, okay, you can see the amnion. So this is the amnion covering, and you can see the stalk. All right, now the point where I want you to focus is at this point. This is the development of arches, first and second pharyngeal or branchial arches. Right, now at this place near the first and second pharyngeal or branchial arches, after some time we have development of a structure which is known as otic placode. Okay, so there is development of a structure known as otic placode. Now, what is this otic placode? You see, this otic placode is a thickening of the ectoderm. All right, so this is a ectodermal placode. Ectodermal placode developed from surface ectoderm. So this has developed from surface ectoderm. It's ectodermal placode, right? So ectoderm has become thick over here. Now what happens to this otic placode? This otic placode, it goes inside. It invaginates. Okay, so when it invaginates, it is known as otic pit. So you see over here, the otic placode has converted into otic pit. And thereafter, this ectoderm, it separates away from the surface. Okay, so it separates away from the surface, and now it is known as otic vesicle or auditory vesicle or otocyst. Okay, so this is known as otic vesicle or auditory vesicle or otocyst. This otic vesicle or auditory vesicle, it differentiates and it forms the membranous labyrinth. That means the membranous part of inner ear. Okay, so it forms the membranous part of inner ear, or you can say the sensory part of inner ear. Right, so this forms the sensory part of inner ear or the membranous labyrinth. Now around this otic vesicle, what do we have? Around this otic vesicle, we have the mesoderm. So you see over here, around the otic vesicle, we have the mesoderm. Now this mesoderm is from where? It is from the branchial arches. Right? This mesoderm is from the arches, and therefore this is generally derived from the neural crest cells. So this mesoderm is a secondary mesoderm. Remember, what derived from the neural crest cells is a secondary mesoderm. Okay, so now this mesoderm, it condenses. So around the otic vesicle, the mesoderm condenses and it forms a structure that is known as otic capsule. Okay, so this is known as otic capsule. So what is otic capsule? Otic capsule is a cartilaginous structure. Okay, so this is formed in embryo. It's an embryological cartilaginous framework of inner ear. Remember, the inner ear, it has cochlea. Cochlea is a spiral structure. There are semicircular canals. There is a vestibule. So it's a complex bony structure. It's not possible for nature to form such a complex bony structure directly. So nature has gone step by step. Okay, first it forms a cartilage. Right? This cartilage we call as otic capsule. So this is known as otic capsule. It's a cartilaginous structure. It is easy to modify and reshape the cartilage. So this cartilage undergoes a lot of modification. It forms the spiral cochlea, it forms the semicircular canals, it forms the vestibule, and then in this cartilaginous structure, ossification takes place. Right? So this otic capsule, which is formed by the mesoderm, this undergoes ossification. Okay, so this otic capsule, it undergoes ossification and it will form the bony inner ear, bony labyrinth. Okay, so bony part of inner ear, so that develops from otic capsule by ossification. By how many centers? By 14 ossification centers. Remember how many were there in temporal bone? In the temporal bone we had 20. Out of 20, 14 are there in the otic capsule and they form the bony inner ear. Where is the bony inner ear? The bony inner ear is in the petrous part of temporal bone. So remember, I said petrous part of temporal bone is the most complex part of the temporal bone. You can see it is formed by 14 ossification centers. Right? Okay, now such a type of ossification that takes place in a preformed cartilage. So otic capsule is a cartilaginous structure. So preformed cartilage. So such a type of ossification that takes place in a preformed cartilage is known as enchondral ossification or calcification. Okay, and such a type of bone formed is known as enchondral bone. So that means the type of bone in the inner ear or in the petrous part of temporal bone is enchondral bone. Okay, as you can see, a small piece of bone, the petrous part, is formed by 14 ossification centers. So therefore, it makes the petrous part as the hardest or the densest bone in the body. Hardest or the densest bone in the body, that is the petrous part of temporal bone. Now many students over here get confused. So now let me clarify it. Suppose I ask you which is the strongest bone in the body, your answer has to be femur. Now when we say strongest, so that is the weight bearing capacity of the bone. Right? So that is the weight bearing capacity, and therefore the strongest bone is considered to be the femur. Right? So when we say the hardest or the densest, so that's the drilling. Okay, so that's the density of the molecules. So that is the petrous part of the temporal bone. Okay, so hardest and strongest, these are two separate words. They have separate meaning. All right. So this was the petrous part of the temporal bone and the formation of the inner ear. Now, what we have seen? We have seen the formation of otic vesicle and the otic capsule. We know the otic vesicle forms the membranous labyrinth. The otic capsule, it forms the bony labyrinth. Now let's look in this photograph. So this is the growing embryo. We can see over here, that's the otic vesicle. Now what happens to this otic vesicle? It differentiates. How? This will form a structure which has a duct for endolymph, that is endolymphatic sac and duct, and we have two parts, pars superior and pars inferior. So it differentiates into these two sac-like structures, pars superior and pars inferior. Okay, the otic vesicle. Now what happens to pars superior and pars inferior? The pars superior further differentiates and it forms the utricle and the semicircular canals. Okay, the pars inferior, it forms the saccule and the cochlea. Right? It forms the saccule and cochlea. Now how does that formation happens? You can see between the utricle and the saccule, we also have the utriculo-saccular duct. So that is the place for constriction. Right? Now let's look over here. This is the pars inferior. Now what forms from pars inferior? We just saw from the pars inferior, there is formation of saccule. So this structure, this sac-like structure is known as saccule. Now below the saccule, you can see that there is a tubular outgrowth. This tubular outgrowth will grow further and it forms the cochlear duct that will lead to further formation of the cochlea. So it's a spiral structure. So remember, the saccule and the cochlear duct, they are formed by the pars inferior. Now between the saccule and the cochlear duct, you can again see that there is a constriction that's known as ductus reunions. This connects the auditory part of the inner ear to the vestibular part of inner ear. Right? Between the saccule and the utricle, we had a utriculo-saccular duct. Okay. Now, this is how the inner ear is formed. Right? Okay, so this question has been asked recently in the January 2020 NEET exam. Saccule of ear develops from. So remember, saccule as well as the cochlea, they both develop from pars inferior. All right. Okay, so that brings us back to the temporal bone. Let's go back to the osteology. Let's finish it completely, then we'll come back to embryology. So we have discussed the two parts, the squamous part and the petromastoid part. Now we know petromastoid has two processes, the petrous and the mastoid process. Okay, we have discussed each of these processes separately. Now let's look over here. We saw the EAC. In the EAC, these bony walls of the EAC, they are formed by the tympanic plate of bone. That's the third part of temporal bone. And number 4, we have a process going down from the temporal bone, that is the styloid process. Okay, so there's the 4 parts of the temporal bone that we said in the early beginning, squamous, petromastoid, tympanic and styloid. Right? Now, in the embryological phase, when still the child we have as an embryo, between the squamous part and the petrous part there is a suture. Okay, that suture in the embryological phase, that is known as petrosquamous suture. And this petrosquamous suture between the petrous part and the squamous part, this disappears. This part, this suture disappears after birth. However, if this suture does not disappear, okay, so if it will not disappear, we will call it as persistent petrosquamous suture. So it is known as persistent petrosquamous suture, also known as corner's septum. Right? So a persistent petrosquamous suture is also known as corner's septum. Let's look at this image. What is this image? Is it a X-ray? Is it a CT scan? Or it's an MRI? So number one, you can all say it's not an X-ray. Why? It's not an X-ray. Why? Because X-ray, you do an X-ray, you will have all the bones superimposed upon each other. This is a cross-section. Okay, cross-sectional study is either CT scan or MRI. Now, which one it is? So very easy. We see bones in CT scan. We cannot see bones in MRI. Now over here, the white color bone is visible. So it's of course a CT scan. Okay. Now which part of the body is the CT scan? So you can see over here, you can easily identify the pinna. So sometimes soft tissue are useful to identify for us the structure. So we can see the pinna on both the sides. So this is the CT scan of the skull and we can see a bone over here. So which ear bone will this be? This will be the temporal bone. So we are looking at the CT scan of the temporal bone, right? Okay. Now, what do we see over here? You can see over here a lot of air cells. So which part is that? That is the mastoid part of the temporal bone. Okay, medial to that you can see this is a very dense part. So this dense part, very dense part having some structures inside, that is the petrous part of temporal bone. Right, you can see the mastoid part, lot of air cells. You can see the dense part, the petrous part. Look carefully in the mastoid part. So when you look carefully in the mastoid part, you can see over here one very large cell. Okay, that is the largest air cell of mastoid and we call this largest air cell as mastoid antrum. Okay, so that is also visible to you, the mastoid antrum. Inside the petrous part, you can see some cavities over here. So this in the dense part, that is likely to be your inner ear. Right? Okay, is that clear to you? Very good. Now, in the anterior part, you can see some structure over here. Let me draw it. This structure over here, which appear to you like a ice cream cone, these are your ear ossicles. Okay, so where are the ear ossicles? The ear ossicles are in the middle ear. So that's your middle ear containing the ear ossicles. They look like a ice cream cone. Right? This cone, ice cream cone appearance is formed by the head of malleus. So you see the head of malleus, it forms the ice cream. The softy cone, this cone is formed by incus. Okay, body of incus and short process of incus. Of course, we will be studying this later on in detail, each of these things. So I'm just, arising your curiosity over here and just telling you different things. All right, so that is your ear ossicles. We see the ice cream cone appearance of ear ossicles, so that is the middle ear. Now let's say I want to do a surgery. All right, let's study the surgery. I want to open the mastoid antrum. This is my mastoid antrum. I want to do a surgery and open it up. So what do? I give an incision behind the pinna, good incision, hidden behind the pinna. Now I cut the skin and I reach the bone. Okay, so what can I do now? I will drill this bone. I drill this bone and I reach into the antrum. Clear? This is how I can do it. Okay, now let's do the same surgery on the other side. Let's discuss the other side. So other side we identified the pinna, we know this is the temporal bone. You can see some cells, not as many as the right side, but you can see some cells. So this is your mastoid part. Okay, you can see the largest cell of the mastoid over here, that is your mastoid antrum. Okay, so far so good. Medial to that you can see the dense part of temporal bone, that is your petrous part of temporal bone. In the posterior surface of petrous part, you can see an opening also on this side. This opening is the opening for IAC or IAM. Remember, IAC or IAM opens in the posterior wall of petrous part of temporal bone. Now, why I was not able to see this opening on the other side? Okay, for a very simple reason, that while doing the CT scan, maybe the patient head was little tilted like this. So when the patient head is tilted, if I am doing a cross section, I can miss some structure on the left side which is there on the right side. Okay, so that is possible, but then that structure I will see in another cross section. All right, it's a series of cross section. We try to keep the patient head in the neutral position so that we see both the structures, you know, one against the other. But sometimes even a few millimeter tilt can lead to the disappearance of these structures. Remember, these are all very, very small structures. So even a few millimeter shift can alter the appearance. So one may be not visible in one cross section, you can see it in the above or the lower cross section. That's not a big problem. CT scan, we review series of cross sections, right? So this is your IAC or IAM. Now we can see over here also the ice cream cone appearance. So that is the ice cream cone appearance of the ossicle. So this part is there for the middle ear, right? Okay, now let's say we want to do a surgery and we want to open the mastoid antrum on this side. So once again, I give an incision, I cut the skin, I reach the bone and I start drilling the bone. Now when I drill the bone, before I reach the antrum, I encounter a thick plate of bone over here. This thick plate of bone is known as corner septum. Okay, so this thick plate of bone is known as corner septum, persistent petrosquamous suture. And that is the importance of corner septum. What is the importance? This hides the antrum. It is lateral to antrum. Okay, the corner septum is lateral to antrum, or you can say the antrum is medial to corner septum. Okay, so antrum is hidden medial to it. Therefore, while doing surgery, it becomes difficult to find the antrum if corner septum is present, right? It becomes difficult to find the antrum if the corner septum is present. So that is known as corner septum persistent petrosquamous suture, and that is the surgical significance of this septum. Okay, right. Now that was the osteology of the temporal bone. Let's come to the embryology of the ear. Now, after having understood the osteology of the temporal bone, let's go and understand the embryology of the ear. To understand the embryology of the ear, it is very important for us to understand the pharyngeal or the branchial arches. So, how many arches do we have? We have 5 pharyngeal or branchial arches. Okay, 1, 2, 3, 4, and 6. The 5th arch disappears in human beings. All right, so we'll not talk about the 5th arch. So we can see over here the development of the optic placode, and near the 1st and the 2nd arch you can see the development of the otic placode. So this part we have already talked that the otic placode leads to formation of the inner ear. Which part of the inner ear? The membranous inner ear, membranous labyrinth, right? Okay, so let's talk about these pharyngeal or branchial arches. Now each arch is formed by ectoderm on the outside, right, endoderm on the inside, and there is mesoderm in between. So each arch is formed by all the 3 germ layers. Each arch has its own blood supply, nerve supply, forms its own muscles and cartilage, right? Each arch on the ectodermal side has a pharyngeal cleft or a ectodermal cleft. Okay, so between each arch on the ectodermal side there is a cleft, and on the endodermal side there is a pouch, right? So on the endodermal side there is a pouch, on the ectodermal side there is a cleft. Okay, so we'll talk about these arches and the clefts and the pouches. So let's first talk about the arches. So let's first talk about the first arch. The first arch is traditionally known as the mandibular arch, right? I'll call it as the M arch. So remember, most of these structures inside this arch starts with M, so I will call it as the M arch. So first arch is our mandibular arch. But remember, some people, they say the first arch has two processes, the maxillary process and the mandibular process. Okay, so they consider that mandibular arch, in fact this arch has two processes, maxillary and mandibular. Okay, so that's a different point of opinion. Let's discuss the artery. The blood supply of this arch is the maxillary artery, starts with M. So as I said, everything starts with M. Okay, mandibular arch, maxillary artery. Nerve, again mandibular nerve. Now in the first and the second arches, the main nerve supply is actually the motor nerve supply, also known as post-traumatic nerve supply. So this is the motor nerve supply or the post-traumatic nerve supply, that is the mandibular nerve. First and second arches, they have an additional nerve supply, that's known as pre-traumatic nerve supply. Okay, this is the sensory nerve supply. Okay, and this is the branch of next arch nerve supply. Okay, so what do I mean? Chorda tympani nerve, this is a branch of facial nerve, and facial nerve, the seventh cranial nerve, is actually the post-traumatic nerve of second arch. Okay, so this is the post-traumatic nerve of second arch, but it gives a branch that is known as chorda tympani. It supplies the first arch as a pre-traumatic nerve supply. All right, okay, so just remember, pre-traumatic is the branch of next arch motor nerve. Okay, now the muscles. M for mastication, muscles of mastication. What are the muscles of mastication? We have the masseter, we have the median and lateral pterygoid, and we have the temporalis. So these are the muscles of mastication. Okay, right? Now around these muscles we have a fascia. Okay, so around these muscles we have a fascia, and therefore between the fascia and the muscles there is a space that is known as masticatory space. Okay, this is space known as masticatory space. If there is an abscess, there is an infection in this, that will be known as masticatory space abscess. Right? Okay, now remember, this masticatory space can be divided into three further spaces. Which three further spaces? Masseteric space, pterygoid space, and temporal space. Okay, so that's just a teaser for you. We will be discussing all the different spaces later on in the topics. Right? Okay, so number one, we have the muscles of mastication. M, masseter, medial and lateral pterygoids, temporalis. Then we have the mylohyoid, again starts with M, easy to remember, mylohyoid. Okay, then we have the anterior belly of digastric, very important question, anterior belly of digastric, right? And then we have two tensor muscles, tensor tympani and tensor villi palatini. Okay, so tensor tympani and tensor villi palatini. So these are the muscles of the first arch. Let's come to the skeleton. The cartilages of the first arch, again we can divide into maxillary process and mandibular process. So the maxillary process cartilage is known as quadrate cartilage, right? And this quadrate cartilage forms your maxilla, it forms your premaxilla, it forms a zygomatic bone, the squamous part of temporal bone, right? Okay, now the mandibular process or the actual mandibular arch, it forms the Meckel's cartilage. So somebody asks you a question, which is the cartilage of first arch? You have to give the answer as Meckel's cartilage. Okay, somebody asks you a specific question like which is the cartilage of maxillary process of the first arch. So now he has specified it, therefore you will say answer is quadrate cartilage. So be very, very specific in your answer. Look carefully what the question has been asked. General question, general answer. Specific question, specific answer. Cartilage of first arch, Meckel's cartilage. Okay, cartilage of mandibular process of first arch, again Meckel's cartilage. But cartilage of maxillary process of first arch, then quadrate cartilage. Same way, nerve of first arch, answer is mandibular nerve. Mandibular nerve is branch of trigeminal nerve. Okay, so we write it as V3. Third branch of trigeminal nerve, fifth cranial nerve. So we write as V3. Okay, so nerve of first arch, answer is mandibular nerve. Post-traumatic nerve of first arch, again answer is mandibular nerve. Pre-traumatic nerve of first arch, then your answer changes to cauda tympani. Right? Okay. Now let's look what forms from the Meckel's cartilage. From the Meckel's cartilage we have M, mandible. Number 2 we have malleus and incus, 2 ear ossicles, ear bones. Malleus and incus form from the first arch, Meckel's cartilage. Then we have anterior ligament of malleus also. Okay, so attached to malleus, this ligament is also formed from first arch. Okay, then we have the sphenomandibular ligament. Very important. Why? I will tell you later. Sphenomandibular ligament. Okay, so now after the sphenomandibular ligament, now we come to the next arch, the second arch. Okay, the second arch is known as the hyoid arch. For remembering this arch, I have labeled it as S arch. So these are M arch, S arch, these are all hypothetical names that I have given to make them simple and easy to remember. Okay, so M arch, S arch, this is your S arch, hyoid arch. Most things over here starts with S, like artery. What is the artery? Stapedial artery. Right? Nerve, post-traumatic nerve. Remember, we have already talked, is 7th cranial nerve, that is your facial nerve. But it also has a pre-traumatic nerve, and that is the Jacobson's nerve. Remember, this is a branch of glossopharyngeal nerve, 9th cranial nerve. Glossopharyngeal nerve supplies the third arch. Okay, so this is the pre-traumatic nerve supply, that is the sensory nerve supply. The post-traumatic or the motor supply is the facial nerve. So what does the facial nerve supplies? Which muscles? Muscles of facial expression. Okay, how many muscles are there for facial expression? We have 43 different muscles of facial expression. Okay, it's difficult to remember all the names, but let's revise a few names. Number 1, we have the buccinator. Okay, important muscle, buccinator. Then we have auricularis, frontalis, platysma, orbicularis oris, orbicularis oculi. Different muscles, we'll talk about them. Now, other than these muscles of facial expression, do we have anything important? Yes, we have the posterior belly of digastric. Very, very important. Okay, why important? You see, anterior belly of digastric is formed by the first arch, whereas posterior belly of digastric is formed by the second arch. And this question is asked in the exam, which of the following muscles is not formed by second arch, or which of the following muscle is not supplied by facial nerve. Now you see, the confusion is generally between anterior belly and posterior belly of digastric. So remember, anterior belly first arch, posterior belly second arch. Other than these muscles, we have the stapedius, that is the smallest named muscle in the body. Okay, smallest named muscle in the body, stapedius, and it starts with S, so very easy to remember, belongs to S arch. Right? Finally, we also have stylohyoid, again starts with S, easy to remember. Okay, now the second arch cartilage is known as Rickett's cartilage. This Rickett's cartilage forms the stapes. The third ear ossicle starts with S. S for second arch. Okay, so stapes. What else? Except the medial surface of this foot plate, which is formed from otic capsule. So we'll talk about it. Okay, next we have the styloid process. Again starts with S. Remember, we have seen the styloid process in the temporal bone. The fourth part of temporal bone, styloid process, the process that comes from below in the temporal bone, inferior surface. So that is formed by the second arch. Okay, now from this styloid process to the hyoid bone, we have a ligament that's known as stylohyoid. Again starts with S. So stylohyoid ligament, right, formed by the second arch. the Ricketts cartilage. Then of course this arch is known as hyoid arch, so therefore this cartilage forms the hyoid bone. Okay, which part of hyoid bone? The body of the hyoid bone and the lesser horn, lesser cornu of the hyoid bone. Now let's look at the stapes bone first before we go ahead. So we'll talk a little bit about the stapes. It's a unique bone in the body, looks like a stirrup where we place our foot while riding a horse. Now this is the smallest bone in the body. What are the parts of the stapes? Number one, we have the head. Below the head we have a small neck. Below the neck there are two cruras, anterior crura and posterior crura. And then finally we have the foot plate. Okay, now this stapes we have discussed is formed by the Ricketts cartilage, that is the second arch. Okay, except the medial surface of this stapes foot plate. This medial surface of stapes foot plate, this is formed from otic capsule. Remember, otic capsule forms the inner ear. Remember, it is a cartilaginous framework of inner ear, undergoes ossification and chondral ossification by 14 centers. So it forms the medial surface of stapes foot plate. Right? Okay, let's come to hyoid bone. So this is a unique bone. It's in the neck and does not articulate with any other bone. Does not have joints. It is attached to only muscles and ligaments. Now, there are three parts of the hyoid bone. Which three parts? Body, lesser cornu, and the greater cornu. Okay. Now, the second arch, it forms this part. Which part? It forms the lesser cornu and the superior part, the upper part of body of hyoid bone. So remember, don't get confused in the exam. How? Lesser, you can also remember a smaller cornu. So S goes to S arch. Upper part of body, remember it as superior part of body. Okay, S goes to S arch, second arch. Right? So this is formed by the second arch. The remaining bone, what forms the remaining bone? The remaining bone, the greater cornu and the lower part of body, this is formed by the third arch. Okay, so this is formed by the third arch. So let's discuss the muscles of facial expression. So how many muscles of facial expression are there? We have 43 muscles. Okay, so I'll not show you all the muscles, but let's talk about the important muscles we can see in the front view. Now, the first muscle that I want to say is the platysma. So it goes from the face to the neck, and this platysma, it covers almost whole of the neck. So this is the first muscle of facial expression. Number two, we have the buccinator. Now remember, buccinator is a muscle of facial expression. It is formed by second arch supplied by facial nerve. However, it also has a secondary function. The primary function is facial expression. The secondary function is mastication. It helps in mastication by pushing the food back into the oral cavity that comes between the teeth and the cheek. It pushes it back. So secondary function is mastication, but primary function is facial expression. Okay, so it is per se not a muscle of mastication. Right? This buccinator and the skin between them, there is a space formed that is known as buccal space. I will be talking about buccal space in topic of pharynx. All right. Now, what other muscles can we see? We can see the orbicularis oculi around the eye, and we can also see the orbicularis oris around the mouth. Okay. Then you can see that there is zygomaticus major, there is zygomaticus minor. Right. We can see the levator anguli oris, levator labii superioris, and below the mouth we have the depressor anguli oris and depressor labii inferioris. Okay, now near these muscles we also have the risorius muscles, right? Okay, so now these were the muscles on the side. In the midline on the nose you can see the nasalis muscle. Okay, above the nasalis there is a small muscle known as procerus. Okay, and you can see the mentalis muscle in the midline at the chin, right? Okay, another muscle that is visible to us in this, yes, we can see the corrugator supercilii above the eyes, and we can see the frontal belly of occipitofrontalis. So I've just enumerated these muscles. All right, you should just know the names. Even if you don't know the names, you can still solve the MCQs. How? Remember, they ask you question like which of the following is not supplied by facial nerve. So remember, the posterior belly of digastric is formed by second arch and is supplied by facial nerve. Anterior belly is formed by first arch. It is therefore supplied by mandibular nerve. Okay, right? Now, let's come to the third arch. The third arch does not have a special name. The third arch artery is common carotid artery and first part of internal carotid artery. Third arch, now I have already discussed, is the glossopharyngeal nerve, the ninth cranial nerve. Now, muscle formed by third arch is stylopharyngeus muscle. Important, stylopharyngeus muscle. Why it is important? This is the only pharyngeal muscle which is not supplied by vagus, but it is supplied by ninth cranial nerve. So it is important. Any other reason it is important? Yes, it is important because this muscle name starts with S and it does not follow our rule of S arch. It belongs to third arch. Okay, so S is important. All right, this question can be asked in the exam. These exceptions you have to remember. Which of the following structures I say is formed by second arch? Let's say question, structure formed by second arch, and I give you option like rhizorius. You don't know this name, no problem. Okay, and I give you a name over here, stylopharyngeus. So you see, examiner is aware that you have made a mnemonic of S arch. That's what everyone does. Okay, so he gives you a trap question over here, stylopharyngeus. So remember, stylopharyngeus starts with S, does not belong to S arch. Okay, the second arch is known as hyoid arch. So question is, which of the following does not belong to hyoid arch or the S arch? Okay, so stylopharyngeus. Third, he gives you option like mylohyoid. Now, mylohyoid has hyoid in it, but remember the M, it starts with M, belongs to M arch. Okay, now fourth, sphenomandibular ligament. So again, I told you sphenomandibular ligament is important. Sphenomandibular ligament once again starts with S, does not belong to S arch. It belongs to mandibular arch. So rhizorius, even if you don't remember this question, you don't remember this name, you can still solve your answer. Okay, instead of rhizorius, I can still say procerus. You don't remember this name, no problem. MCQ, if you don't remember the answer, no problem. You can rule out the choices. Sometimes the questions are given for you to rule out the choices. So you know, stylopharyngeus, third arch, not formed by hyoid arch, second arch. Sphenomandibular, first arch, not formed by the second arch. Mylohyoid, M, first arch. So your answer is automatically first, whatever that X, Y, Z is the choice. So this is how also you can solve the questions. Right? Okay, now let's look at the cartilage formed by the third arch that we have already discussed is the greater horn or the greater cornu and the lower part of body of hyoid bone. Right? Okay, now the fourth and the sixth arch, they combine to form larynx. So they are known as laryngeal arches, and I will discuss these arches along with the larynx. Okay, so fourth and sixth arch form larynx. We will discuss them in the embryology of larynx. Right? Let's look at this different arches and the cartilages formed by different arches. So that's the first arch. It forms your mandible. Okay, the mechal cartilage, it forms the mandible. It forms the malleus, the incus. Right? Okay. Now we have the second arch. The second arch forms the Rickett's cartilage. This Rickett's cartilage forms your stapes. It forms your styloid process. It forms the stylohyoid ligament that goes to hyoid bone. Which part of hyoid bone? Body and lesser cornu. Below that you can see the yellow color, third arch. This third arch, it forms the greater cornu and of the lower part of body. Right? Now the fourth and the sixth arch, they fuse to form larynx, so they are known as laryngeal arches. Right? Okay, so they are the cartilages formed by the different arches. Question, which muscle originates from first pharyngeal arch? Buccinator? No. Muscle of facial expression. Posterior belly of digastric? No. Okay. Masseter starts with M, belongs to M arch. Stylopharyngeus? No. Third arch. Okay. So answer is masseter muscle. Alright. So those were the arches. Let's come to the clefts and pouches. So we know on the ectodermal side, we have the clefts, right? And on the endodermal side we have the pouches. So you can see first cleft, okay, you can see the first, second, third, fourth pouches. All right, now you see the second, third and fourth cleft. First of all, the second, third and fourth cleft, they disappear. They are obliterated by the growth of the second arch. They are obliterated and then they disappear. So nothing formed from second, third and fourth cleft, right? Okay, let's look at the first cleft. Now you see near the first cleft we have the first arch. You can see we have the first arch. This first arch starts growing inside. So near the first cleft, the first arch starts growing inside, and when it grows, it forms your EAC, external auditory canal. So if somebody asks you the EAC is formed by, answer is first arch, right? Earlier it was believed that the cleft itself grows in, but this has now been refuted. The latest update is that the cleft does not grow in, the arch tissue grows in and forms the EAC. So therefore EAC is formed from first arch, right? Okay, now the first pouch also invaginates. So when it grows inside, it forms a tubotympanic recess. This tubotympanic recess, it further differentiates into eustachian tube. So tubo for tube, and middle ear, that is the tympanic cavity, right? So first pouch forms the tubotympanic recess, that is the eustachian tube and the middle ear, right? Now remember, where this ectoderm meets the endoderm of the pouch, we have formation of tympanic membrane. Okay, so ectoderm is brought by the first arch, it meets the endoderm from the first pouch, and now in between there is mesoderm. All the three meet. Okay, so therefore tympanic membrane is formed by all three germ layers. So this is one structure in the body formed from all three germ layers. Okay, now the second pouch, you see, it invaginates, it grows inside and it forms a tonsillar fossa. Inside the tonsillar fossa, the lymphoid tissue deposits and we have formation of palatine tonsils. Okay, so this question is also asked in the exam, second pouch forms. So the best answer is tonsillar fossa. If tonsillar fossa is not in your option, you can mark your answer as palatine tonsils, right? Okay, now the third pouch, you see over here, it forms the inferior parathyroid glands and thymus. Okay, the fourth pouch, you see, it forms the superior parathyroid gland. Now you see superior parathyroid is developing from the lower pouch. Why? Because these inferior parathyroids, when they are formed by the third pouch, they are formed along with thymus. This thymus travels down. It forms in the neck, it travels down and rests in the superior mediastinum. Okay, so therefore these parathyroid are also pulled with it downwards. So they lie inferiorly, therefore they are known as inferior parathyroid glands. Okay, whereas the fourth pouch forms the superior parathyroid glands. Now near the fourth pouch, we have the fifth pouch. Many embryologists now consider it as a part of fourth pouch, but this pouch forms the ultimobranchial body. And this ultimobranchial body forms the parafollicular C cells of thyroid gland, which secrete your calcitonin hormone. Okay, so they secrete your calcitonin hormone. So these are the structures which are derived from these clefts and pouches, right? Okay, question, eustachian tube develops from, answer we know now is the first pharyngeal pouch. Okay, right. Now we have seen the first cleft. We know around the cleft we have the first arch that grows inside. Okay, now around this EAC, so we have the developing EAC over here. Around the EAC, the first and the second arch, they together form 6 swellings. This is known as 6 hillocks of His. Okay, these 6 hillocks of His, they grow and they start fusing with each other. Okay, as you can see over here, they start fusing with each other and slowly they form the pinna. So somebody asked you this question, pinna is formed from, answer is 6 hillocks of His. or you can say first and second arch, right? Okay, now somebody asks you that this is the part tragus, and this tragus is formed by, so you can see the tragus is formed by red color over here. That was the first arch. So tragus is formed by the first arch. The remaining pinna is formed by the second arch, right? Tragus is formed by first arch, remaining by the second arch, right? Okay, so now that brings us to the end of the embryology. We have discussed all the parts of the embryology. How? Let's summarize it so that we can understand what all we have studied. Okay, so we know ear has three parts: external ear, middle ear, inner ear. Okay, so let's first talk about the external ear. We can divide the external ear into further two parts, the pinna and the EAC. Pinna is formed by 6 hillocks of his, which arches first and second arch. The EAC is formed by first arch. Remember, this is an update. Earlier it was believed to be first cleft, but now we know for sure that this is the first arch tissue which goes inside and forms the EAC. Okay, it's the latest update. Then we have the middle ear. What is there in the middle ear? We have the tympanic membrane formed by all the 3 germ layers. We have the middle ear and eustachian tube formed by first pouch. And then we have the ear ossicles. Malleus and incus formed by first arch. Which cartilage? Meckel's cartilage. Stapes formed by second arch. Which cartilage? Ricketts cartilage. Except the medial surface formed by otic capsule. Right? Then we come to the inner ear. And the inner ear we have two parts. Which two parts? Bony inner ear and membranous inner ear. So the bony inner ear or bony labyrinth is formed by otic capsule that develops from secondary mesoderm. Okay, and the membranous labyrinth is formed by otic vesicle that develops from surface ectoderm. Okay, so we have studied the embryology of all the different parts of the ear. Okay.